know you said you went to Prairie View. Do you plan on continuing your education and getting another degree?
No.
No.
What I intend to do is go into creative writing. That's what I want to do.
Yeah, I like that as well.
Mm-hmm.
What do you like? What did you like most about working where you worked?
I liked the people I worked with, and I liked most of the people I went to school with. It was always something that you could learn. That area. In fact, the health field is constantly changing, and hopefully for the better most of the time. So.
What did you like the least about it?
What did I like the least about it? I really can't say that I didn't like anything about it. I liked just about everything about it.
Well, I hope one day when I get older, I can find a job I like all the way like you. And what situations are communication pitfalls or challenges most likely to occur?
The type of patients that we usually encounter, patients who have not been able to go to a doctor, and so they consider the emergency room their doctor. Okay, so they usually go there to the emergency room, and from there they are sent to usually to a clinic or someplace. But the main thing is that they don't have any insurance. Okay, and a lot of them do not even have Medicare or Medicaid, and I understand that it's going to get worse because of sequester.
What are your communication strengths? Like, what are you good at communicating, or how?
I think I just have average communication skills, except when in case of emergency with a patient, when you don't have time to do that much with them, you have to somehow in your encounter with the patient, get them calm, reassure them, let them know that everything is going to be okay, that what you're going to do for them, and say it slowly so that they'll have to calm down themselves. Okay, and that's, to me, that's the most important thing. When you meet a person at the front door, at the emergency room for us, but at your house is your front door. And what you encounter at your front door, you know, is the makings of what's going to happen when that person comes into your house. And in the emergency room, it's the hospital.
Yeah.
Okay, and you have to let them know that yes, yes, you're bleeding, but we're going to help you right away. Okay, and because sometimes there are instances where, as you're encounter patients at a hospital that really is just a specialty hospital, such as psychiatry. And I encountered once a patient who had an esophageal bleed. That means that he was an alcoholic and he just bled and everything, and so we had to give him ice to stop the bleeding right away, take care of him, his vital signs and everything, get the emergency room, get an ambulance there to get him stabilized. And in those instances also you can have patients who are going into cardiac arrest or other things, with all facility hospitals. So you have to use your knowledge and your common sense about what's going on.
Wow, there's a lot going on. I would freak out at that moment. Somebody, you know, and I can imagine a lot of people coming in and they're not understanding that it's a weight, or they're not understanding, you know, that it's an order to things. They just want to be seen automatically.
Yes, that is correct.
Yes. What are the challenges of effectively communicating with patients or other healthcare professionals from different cultural backgrounds?
I think the world of healthcare is constantly changing, and you have to roll with it. Okay, I tell you what I did in high school. I took the one course that we really didn't have much of a need for, and that was Latin.
Yeah.
Instead of Spanish, I took Latin. I could understand some of the things that was going on, but I should have taken Spanish, but it was okay.
How do you handle the language barrier?
How do I try to get a family member to assist with us, and also get them to assure them that they're going to be okay. The doctor's going to take care of them, the nurse is going to take care of them, and they're going to be okay. And if they don't speak any English at all, I usually tell the family, whoever's there with them, to tell them that somebody's going to be coming by to look at them every 10 or 15 minutes, so that they can be reassured that they're okay.
Oh my gosh, you work in everybody's, and sick people are the worst kind of people because they just want something so fast, especially at Bental. Oh my gosh.
I don't think that I think that they really are trying to get their needs taken care of, a lot of them, and some of them are just plain scared. Okay.
Understandable. I can imagine. Does gender play a role in how you communicate, or how other people communicate with you on the job?
Yes, they do. And what has happened recently is there have been more and more male RNs and more male techs to assist you in the care of a patient, because in psychiatry we don't usually have patients who have cardiac problems or something like that, med-surg issues, so therefore you have to have someone of your opposite gender to come in and assist you with that person, because you might bring a patient into the hospital, the patient's okay, and all of a sudden the patient hasn't told you the patient's going into cardiac arrest. Something else is happening with the person, and you have to be reassured and everything, and everything is in a hurry. Everything is in a hurry. You push the button for everybody to appear, and they do appear so that they can get immediate help. So,
what role does nonverbal communication play in your work environment?
Nonverbal, it's a whole lot, because if you speak to the patient verbally and tell them that you're going to be looking in on them at least every 10 or 15 minutes, okay, if they see you coming by, and say, hi, I'm looking, okay, that makes them feel, they'll tell you later, that made them feel much better. They couldn't identify who the person was who was coming by, but the idea, and you have told that person that you're going to take them to the bathroom, and you're going to get them some food, and blah, 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 blah. No, the family can't come in, but they'll be able to visit you at et cetera, hour, et cetera, et cetera. And if you speak slow and low, they have to stop cutting up to hear you. Okay.
How did you learn how to interpret nonverbal communication? Like, how did you figure out how to, I don't know, decide what it was? Or how to...
Well, everyone have a few nuances when they come upon someone else. Okay, like Cameron right now, his eyes have rolled back into his head. Okay, so you can tell that something is going on with his, okay, with him.
Yeah.
Okay, so that's how you know.
Do you have any final thoughts or advice to give me?
Whatever field you're going into, it's a new day for you, and it's full of adventure. Okay, and just like in my field, in your field, you have the chance to be, on TV. You have a chance to work in the White House. Okay, you have all of these chances. Okay, it's just a wonderful day for you. Okay, if you watch TV occasionally when you're looking at the weather or some of the other stuff, you see that I can do that too.
All right. Thank you, Ms. Gray. And that's been it.
Okay.